for Tourette Syndrome and Associated Disorders, NJCTS, its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our website. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate any treatment. You are responsible for your own medical decisions. Now, I'm going to turn over the introductions of our speaker to Martha Butterfield, the Program Coordinator of NJCTS. Marty?
Thank you, Kelly, and good evening, everyone. The goal of our Wednesday webinar series is to provide insight into issues of interest to the Tourette syndrome community. Sometimes, however, it's impossible to offer all the information in one presentation. Therefore, NJCTS is pleased to announce that we will present 2 Wednesday webinars on PANDAS featuring experts in the field of TS with perspectives on the effects of strep infection. Tonight, we welcome Dr. Roger Kurlan from the Atlantic Neuroscience Institute at Overlook Hospital in Summit, New Jersey. Our next look at the issue of PANDAS will continue with a webinar presentation by Dr. James Leckman of Yale University. The date for Dr. Leckman's webinar will be announced in the coming weeks. Now, to tonight's presentation. It is with my great pleasure I would like to introduce Dr. Roger Kurlan, who is here to share his views on the link between strep infection and Tourette syndrome. Dr. Kurlan received his BA from the University of Rochester and his MD from Washington University in St. Louis. He was a member of the faculty in the Department of Neurology at the University of Rochester from 1984 until 2009. He is also the founding and current principal investigator of the Tourette Syndrome Study Group and has published more than 50 articles related to TS. Dr. Kurlan recently became the director of the Movement Disorders Program at the Atlantic Neuroscience Institute at Overlook in Summit. I would now like to turn tonight's webinar presentation over to Dr. Kurlan.
Thank you very much, and it's a pleasure to have an opportunity to talk to everyone tonight. Today I'm going to discuss the topic of pandas, and it's not the cute black and white bears from China that you should be seeing on your screen.
Dr. Kurlan, we're not at this moment. Did you, when I changed presenter, did you say yes and accept? Should be a pop-up button on your screen.
I haven't received that.
Okay. Okay, I'm going to pull it back and then give it back to you.
Okay.
Okay. Okay, did you see anything come up?
Yes.
Okay.
So should I click show my screen?
Show your screen, that's correct.
Okay. Are we in business?
We are in business.
Okay. Now I hope everyone sees those cute bears. But this is not the topic, but rather we're going to talk about the idea that Tourette syndrome, or TS, and obsessive compulsive disorder, or OCD, might be caused by streptococcal infections, possibly by what's called an autoimmune process, whereby the body appropriately makes antibodies to fight the infection, but these antibodies mistakenly attack parts of the body, and in this case we're talking about attacking the brain. This whole notion of PANDAS comes from the condition rheumatic fever, in which strep-related antibodies are known to attack parts of the body, including the skin, the joints, the heart, and actually the brain. And in this circumstance, when the antibodies attack the brain, a condition called Sydenham's chorea develops. And this is a disorder in which children develop a different kind of involuntary movement from tics, more of a writhing or wiggly movement that we call chorea. In my discussion tonight, I'm going to emphasize a large research study that I led to try to carefully determine if there's a time-linked relationship between strep infection and the worsening of symptoms, or what we call an exacerbation, in children with what's called PANDAS. You'll see in the slides that I use the abbreviation GABHS for streptococcal infection. And these letters stand for Group A beta hemolytic streptococcal infection, which is the type of strep that's been implicated in PANDAS. Now, the whole notion of PANDAS comes from an article that was published in 1998 by Dr. Susan Sweeto and her colleagues at the National Institute of Mental Health. And PANDAS is short for pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. It's obviously a lot easier to say PANDAS than that mouthful. But Dr. Sweeto and her colleagues presented specific criteria for diagnosing children with PANDAS, and these are listed on the slide. The first is the presence of OCD or tics. The second is the onset in childhood. They defined it between age 3 years and the beginning of puberty. Third is that there's an abrupt onset of symptoms, or a course that's characterized by dramatic exacerbations of symptoms. And this is called a sawtooth pattern, where there's dramatic worsening of symptoms followed by significant lessening of symptoms. Fourth is that the onset or the exacerbation of symptoms are time-linked or temporally related to infection with strep. And fifth, that there are abnormal results of the neurological examination during an exacerbation. And Dr. Sweeto and her group pointed out that children develop hyperactivity, tics, or what they call choreiform movements. And by this, they mean chorea-like movements, that is, similar to the movements of children with Sydenham's chorea. Now, there certainly is evidence in support of the PANDAS hypothesis. We've got the 50 cases reported by Dr. Sweeto, and others have been described in the literature as well. Dr. Sweeto and others described that if you look at the blood of children with PANDAS, they find increased amounts of antibodies that are directed against nerve cells or neurons. There has been a reported link to something called D817, which is a marker on white blood cells circulating in the blood that has been associated with the development of rheumatic fever. There are also reports in the literature that children with PANDAS can respond to plasma exchange, something called intravenous immune globulin, and antibiotics. And these are treatments to either eliminate streptococcal infection or to try to reduce or eliminate circulating antibodies. And finally, there have been animal models reported in the literature that when you infuse serum from children with PANDAS into brains of animals, they were said to develop abnormal movements and abnormal behaviors. But there's also evidence against the PANDAS hypothesis, and this has led to significant controversy. First of all, there are problems with the criteria for diagnosis that were laid out by Dr. Sweeto. So the clinical spectrum, which was initially defined as just tics and OCD, has been extended by a number of articles to include ADHD, other involuntary movements, even the psychiatric condition anorexia, and literature from the group Got Strep that's trying to publicize PANDAS included a variety of other conditions, including separation anxiety, mood changes, sleep disturbances, nighttime bedwetting, daytime urinary frequency, changes in fine and gross motor skills, and joint pain. And when the clinical spectrum becomes so generalized, it is difficult to characterize it as a single entity. Also, it makes the hypothesis much less believable because the basic hypothesis suggests that the antibodies that are directed against strep attack antigens or proteins in the brain that are similar, and the hypothesis was that these are located in a deep and specific part of the brain called the basal ganglia, which is associated with tics and OCD. But if really a whole range of childhood behavior and movement problems seem related, it makes the hypothesis much less tenable. The sawtooth course that was described for PANDAS as being characteristic is not uncommon in children with Tourette syndrome or OCD who have no evidence of being related to strep infection. Also, the literature is clear that the time relationship between strep and clinical features has never been established properly. And one of the reasons is based on item number 2, that we do know that a single isolated positive strep culture or a single anti-strep antibody blood test is really meaningless. Children often have positive strep cultures and they often have elevated antibody levels, even if they do not have an active infection. And this is common in something called carriers, that is children who are colonized in their throat by strep. And so a single culture or a single blood test is not useful to establish a strep infection. The reports of anti-neuronal antibodies in the bloodstream and the link to this D817 marker reported by some investigators has not been consistent, and a number of studies have shown no association or no abnormality in children with PANDAS. The treatment studies of IVIG, plasma exchange, and antibiotics have all been criticized for a number of problems with the design of the study. And another published study found no evidence that if you take children who develop a strep infection and you keep them on penicillin, that they're less likely to develop tics or OCD. Also, another interesting study followed children with strep infection and also a group with a viral sore throat and found that over time there was no difference in the future development of tics or OCD. And finally, when the animal models were tested in a blinded fashion, which means that the people who were evaluating the animals did not know whether the animals received serum from PANDAS patients or an inactive injection, something called a control, they were not able to distinguish the differences in movements of the animals. So it didn't look like those initial animal studies had much validity. There has been a lot of controversy about PANDAS, and this is probably related to the last couple slides, that there's some evidence that suggests that there may be some truth to the hypothesis, but also a fair amount of evidence against it. But it has generated a lot of concern and interest. I show one headline from the USA Today in 1999, "Common strep churn can make your child mentally ill." And obviously this sort of information is taken quite seriously by parents, doctors, and it has created a lot of concern around the world. This is a condition that I've been interested in for a long time. I've been a long-time expert in treating patients with Tourette syndrome, and so I have personally followed the literature very carefully and have written a few articles reviewing the scientific pros and cons about the hypothesis. Even though it is controversial, it's important. If PANDAS is real, it's a potentially preventable and treatable condition. It might explain cases of Tourette's or OCD that didn't respond to the usual treatments. And if it's related to rheumatic fever or Sydenham's chorea, then children with PANDAS potentially could be at risk to developing heart problems, which is something that occurs with rheumatic fever. So about 5 years ago, I formed a group of scientists around the country to carry out a scientific study that was called PANDAS and Strep Infection, Are They Linked? I served as the prime investigator for the study. We have a national expert in epidemiology, Dr. Tanner, is one of our leaders. and a world-renowned expert in streptococcal infection from the University of Minnesota, Dr. Kaplan, was a leading scientist to help us with the study. This shows the participating sites around the country, and you can see we have a pretty good geographical distribution, which means that the results of our study should be pretty generalizable. The study involved the multiple centers, was what's called a prospective case control cohort study. This means that we enrolled pairs of patients. One member of the pair had PANDAS, and the other member of the pair was a control, meaning that they had Tourette syndrome or OCD, but they had no known link to Streptococcus. And there were 40 pairs involved for a total of 80 subjects. The controls and the PANDAS cases were carefully matched by age. They had to be within 2 years of age. By geography, so they were enrolled from the same site. And by the same time of year, they were all enrolled within 1 month of each other. And it's very important to match like this because these are the factors that determine the likelihood of a child being exposed to Streptococcus. And this was a long study for the patients. Each child participated for a little more than 2 years, 25 months. Our primary objective was to determine by very careful clinical and laboratory monitoring over time whether there is a time-linked relationship between strep infection and exacerbations of tic disorders or OCD in children who meet the criteria for PANDAS. All children, both the PANDAS cases and the controls, had OCD or a chronic tic disorder, usually Tourette syndrome. They all have had their onset before puberty, and their current age was 7 to 14 years. The cases met all of Sweeto's published diagnostic criteria, and we were also especially strict in that there had to be 2 incidents, either the onset of the condition and an exacerbation, or 2 exacerbations that were linked to strep. We also insisted that there be laboratory evidence of the strep infection in at least 1 case. The controls had no history of streptococcal infection being related to the onset or exacerbations of their symptoms. This was a tough study for the kids and their parents. Each child had a throat culture done every single month. They had routine clinical assessments, a throat culture, blood tests for anti-strep antibodies called ASO and anti-DNase-B, blood drawn for anti-neuronal antibodies every 3 months. And in addition, we repeated all of these tests if the child had a clinical exacerbation, if the child became ill, and even if someone else in the household became ill, like a parent or a sibling. And with these tests, we knew that we would not miss a strep infection. We would be able to document every single strep infection that occurred in each child. This slide shows some of the results. It describes the group of patients who participated in the study. And you don't have to look at all the numbers, but basically the PANDAS cases and the control children were very similar in almost all respects, and that's exactly what you want to see in a good scientific study. The 2 exceptions were that, interestingly, the PANDAS cases were more likely to describe a family history of rheumatic fever. 22.5% reported it, whereas in the controls only 5.3% did. And we found this was very interesting, suggesting the possibility that perhaps PANDAS cases have some kind of genetic likelihood of developing strep infection. The other difference was that if you look at other ratings under CYBOCS, that's a rating for obsessive compulsive severity, and children with PANDAS had a higher rating than the controls. And this also makes sense because OCD is thought to be a pretty common component of PANDAS. Now this slide summarizes the basic results, and if you look in the first row and the the first large row, you'll see that the PANDAS cases actually turned out to have more clinical exacerbations, a total of 40 versus 25 for the controls. If you look down a little bit, you can see that the PANDAS patients had more strep infections than the controls, about 37 versus 19. Now this slide actually does a statistical analysis on those results. And on the far right column, if a number is less than 0.05, it means that there is a significant statistical relationship. So in terms of clinical exacerbations, the PANDAS cases were just barely statistically more likely to have a clinical exacerbation than a control population. If you look at strep infection, you'll see that depending on how you define the strep infection, and there are various ways you can define it as definite, probable, or possible, you see that in most of the definitions that PANDAS cases were more likely to have a strep infection. And then in the last group, we see that there really was no difference between the groups in terms of non-strep infections. And we can diagnose throat infections that were not related to strep, for example. This table is kind of the key summary of the results. And this shows what we called hits. And a hit is defined as a time-linked relationship between a strep infection and a subsequent exacerbation. And you can look at a whole variety of different time windows. Our original plan when we designed the study was to look from 0 to 4 weeks, which means that from the time of a strep infection, if the child had an exacerbation of their symptoms within 4 weeks, that was considered a hit or a temporal relationship. And if you look across, these are the PANDAS cases, you see that there were only 3 hits, that only in 3 situations was there a link between strep infection and clinical exacerbation. There are more hits if you define the strep infection more loosely. And if you look on the far right, wherever there's an asterisk, it means that the number of hits were more likely than expected just by chance alone. And it does look like the PANDAS cases were more likely to have a relationship between strep infection and an exacerbation of their tics. Now, if you look at the controls, the non-PANDAS cases, it's interesting to see that they were more likely than chance to have a clinical exacerbation related to a non-strep infection, that is, for the most part, a viral throat infection. So this was a very curious finding. Now, it's important to know that this study does not fully address the issue of PANDAS. For one reason, we only looked at exacerbations and we did not examine the relationship between strep infection and the onset of symptoms, which is an important part of the PANDAS hypotheses. And we also observed fewer clinical exacerbations and fewer strep infections than we anticipated. But to summarize our results, it looks like compared to controls, the PANDAS cases had more strep infections, they had more clinical exacerbations, and they had more temporal links between strep infection and their clinical exacerbation. That is, they had more hits, but they actually had fewer links to non-strep infection. That is, the controls were more likely to have an exacerbation after a viral throat infection. The key finding is really the second one, is that even if you look at the PANDAS cases, strep infection was an evident precipitant for a very small minority of the exacerbations. depending on how you define strep infection, only 7 to 25% of the exacerbations had any evidence of antecedent strep infection. In other words, 75 to 93% of clinical worsenings in these patients do not appear to have anything to do with strep, which seems to be a very strong nail in the coffin against the PANDAS hypothesis. We conclude that the PANDAS cases represent a subgroup of Tourette's or OCD patients who seem to be susceptible to strep infection as a precipitant of their symptoms. But it's not the only, and it's not even the most common precipitant for these patients. It's also likely that there are probably other subgroups with other preferred precipitants. For example, we saw that in the controls, several had exacerbations related to viral throat infections. So it's really unknown whether separating out subgroups based on the clinical precipitants has any clinical or scientific merit. I think many of us who have been part of this research study suspect that it's really the brain's stress response might be a final common pathway that mediates exacerbations. And this comes from the information that not only has strep been suggested to be a precipitant of symptoms in patients with Tourette syndrome, that is the whole PANDAS hypothesis, but there are reports of the common cold, the mycoplasma infection, which causes walking pneumonia, non-strep infections, general stress, exposure to environmental heat, and exercise have all been suggested to worsen symptoms. And we think the common thread is that all of these are associated with general stress. And there has been interesting information to suggest that during stress, there's actually an increased release of dopamine in the brain in exactly the same region that appears to be the site of problems with Tourette syndrome. And as most people know, it looks like Tourette's patients have an increased sensitivity to dopamine. So that any kind of stress that will release dopamine would be expected to worsen symptoms. Another interesting series of research studies has suggested that during times of stress, not only is dopamine released in the brain, but dopamine is also released into the circulation, that is the bloodstream. And this dopamine changes immune markers, and these are immune markers that have been suggested to be related to PANDAS. So it's very possible that these changes are just nonspecific and they're related to stress and not particularly or specifically related to streptococcal infection. So to conclude, I should also mention that another study very similar to ours was recently performed by Dr. Lechman at Yale and found virtually identical results. In fact, Dr. Lechman's study found no hits between strep infection and their PANDAS population. Again, another large study that suggests that the relationship is very weak. So I think that there is good evidence now that shows that strep infection does not appear to be an important factor in causing a worsening of symptoms in children, even if they meet the pseudo criteria for PANDAS. There does not appear to be a role for assessing for or treating strep in these children unless there's signs of an acute infection. The symptoms, the tics or OCD, we think should be treated in the usual way. I'm not totally dismissing PANDAS though, because I do think it's possible that there might be a different kind of patient that does indeed have a strep-related autoimmune process, but not as defined by the pseudo criteria. My guess is that these are patients who experience an acute and dramatic onset of tics or OCD associated with other neurological problems, who also show signs of brain swelling on their MRI, their brain imaging scans. And some of these patients have indeed been described in the literature and have been highlighted in some public press. But I think the whole notion of PANDAS needs to be revised. It certainly is not as presented by Sweeto, and certainly more research work is needed. So I'm happy to address any questions. Thank you.
Thank you very much, Doctor. And I'm now going to begin to cover the questions that have been posted. This one just showed up just on the last minute, but it relates to something you just said. So I want to address that one right away. Did you say that you would not treat strep? Is that what I thought you said?
What I said is that when children present with tics or obsessive-compulsive disorder, I would not do extra studies of strep infection like throat cultures or blood tests.
Okay,
and
you would not go looking for strep.
Correct.
Okay,
but if the child has a fever or a sore throat, just like any child, you would assess for strep infection and treat if it's found.
Okay, all right. I just didn't quite understand that one. All right, so here we go. What is your opinion on whether TS can be triggered by other infections, non-strep, what was called PANDAS at some point in the past?
Yes, I think this relates to my last point. My own opinion and that of most of my colleagues is that any kind of infection or any event that can increase stress can worsen the symptoms of Tourette syndrome and OCD. We do know, for example, many children seem to have a worsening of symptoms associated with seasonal allergies, associated with final examinations in school, associated with psychodynamic problems with their friends or their family, the loss of a pet, the loss of a loved one, the divorce in a family. And I think the common link in all of these conditions is the development of stress. And there's growing information, as I outlined, to indicate that stress produces changes in the brain in dopamine and other chemicals that really would be expected to worsen the symptoms of Tourette syndrome. So it really does make sense. And the key thing is we don't know it really is logical to pull out streptococcal infection as something that's particularly different or unusual compared to other causes of stress.
Okay, thank you. Is there a blood test that can be done to determine if a child has PANDAS? And if so, would this have to be done within a specific time period?
There is no blood test for PANDAS, and the blood tests that I've been talking about are largely the blood tests for diagnosing strep infection. But it's very, very important to recognize that a single blood test is not helpful. Many patients are diagnosed with PANDAS if they develop OCD or tics, and their ASO, one of the anti-strep antibodies, is elevated. A single measurement really doesn't mean anything. In the study we did, we found children who had an ASO that was elevated every single time, every single month. We checked their blood for a period of 2 years, and they had no evidence of an acute strep infection. So these are children who are probably colonized, meaning they have strep in their throat that really doesn't enter the body and doesn't cause any problems. The key is to serially test the blood over a period of weeks, and the key to the diagnosis is seeing a rise in the antibody titer, a significant rise. A single measurement, or even a throat culture. A throat culture can be positive if a child is colonized by strep. Doesn't necessarily mean it's an actual infection. So these blood tests are often more misleading than helpful.
Okay. Oops, the screen just jumped on me. Find my spot here. How do you MRI a severe patient, a patient with severe TS?
If an MRI is important, we do sedate the patient, and there's a number of ways to sedate them, including using anesthesia. So even patients with severe movement problems can have very accurate MRIs done.
Okay. A question about a student who had a severe tooth abscess and soon after developed a dramatic tic disorder. Is that something you've ever heard of? Was it coincidence? Any comment on that?
Again, I think any kind of stress can bring out the symptoms of Tourette syndrome or OCD. As I reported, that there are a number of articles in the literature that mention all kinds of things as bringing out Tourette syndrome, ranging from the organism that causes walking pneumonia to strep to viruses to the common cold. It just goes on and on.
Okay. Do you have any thoughts on the use of prednisone to treat an exacerbation following an illness?
I think there's absolutely no evidence for the use of prednisone in children with Tourette syndrome or OCD.
Okay, you feel strongly about that then?
Yes, it's a potentially quite dangerous treatment.
Okay. Let's see. Do you suggest tonsillectomy or prophylactic augmentation for PANDAS patients? We have found this to be very helpful for our son.
Again, I'm not sure exactly what PANDAS patients are. I think the decision to do a tonsillectomy would be the same whether or not the child has Tourette syndrome or OCD. It's generally based on the development of frequent bothersome strep infections.
Okay. What are the risks of treating with high-dose antibiotics in the long term?
Antibiotics are potentially dangerous medications. They can cause problems with the liver, the kidneys. They can cause allergic reactions. And the main problem for society is that with widespread use of antibiotics, there is a likely development of streptococcal and other organisms that are resistant to our treatments. And I think people have heard a lot about MRSA, which is the resistant staph infections. This is thought to be related to excessive use of antibiotics in humans as well as potentially in our animal livestock. So if people start using antibiotics for any kind of childhood behavior problem, like mood changes, sleep disturbances, changes in motor skills, joint pains as suggested by some, I think there's a real danger of developing treatment-resistant organisms.
Well, I think we're already doing that anyway with all the types of antibiotic hand wash and all that stuff that's out there now.
Yes, and most infectious disease experts feel we're making a big mistake doing that.
It's well known that you should complete your prescription of antibiotics, and you shouldn't stop in the middle. Is there any evidence that not completing the full prescription can complicate anything related to a tics or OCD, or is it just bad form to do it anyway?
Again, I do not think there is any good scientific evidence that antibiotic treatment has any value for children with tics or OCD. So the question about whether you should finish your course of antibiotics is strictly related to whether or not it's being used for an appropriate infection. If it's being prescribed for a streptococcal infection that's been documented, the full course should be completed. Now, many parents don't realize that if you don't treat a strep infection, the body will eradicate it without antibiotics. The problem is, and the reason we're so careful about using antibiotics, is not to get rid of the strep infection immediately. The problem is to prevent development of rheumatic fever. And rheumatic fever has almost totally disappeared from our population, and that's because pediatricians are careful about diagnosing strep and appropriately treating.
Okay. How can you explain PANDAS children who get well after treatment with immunosuppressive therapy. Is this not PANDAS?
Well, first of all, these children are described as having a sawtooth course, meaning that they have dramatic exacerbations and dramatic improvements. And unless the child is treated in a controlled study that includes placebos, I think one really wouldn't know whether the intervention was responsible for the improvement or whether the natural course of improvement would have happened. And that's always been a problem in treating children with Tourette syndrome, because they wax and wane in their symptoms. And when they come in to see the doctor, they're often at the worst state of their tics. And I can tell you that almost any treatment I give to a patient with severe tics will result in improvement. But I can also tell you if I didn't give them any treatment, they would also get better, because that's the natural course of tics. They wax and wane on their own. So one has to do very careful scientific studies that include a placebo, that includes what's called blinding, where the patient and the rating investigator don't know what treatment the patient is receiving or when they are receiving it. And these careful studies just have not been done for PANDAS. And fancy interventions like plasma exchange and IVIG and those things probably carry a very strong placebo effect. People have a lot of investment into these things. And it is known through a whole variety of scientific studies that tics and OCD are indeed very susceptible to placebo. And that's why it's very, very important to do the appropriate studies and to have a large enough population of patients to really know whether something works. We do know from some statistical analyses that you have to have at least 50 patients in a study to determine whether a new medication does indeed suppress tics. And that relates to this variability of the symptoms and the fact that the tics are going to get better no matter what you do. And I haven't seen any study of PANDAS of any intervention that even gets close to those sorts of numbers.
Okay. Do you suggest any alternate treatments for patients during severe exacerbations of symptoms?
At this point, I don't think there's evidence for any particular complementary alternative medicines. I actually wrote a chapter in a recent book about this. There are a number of things that are being used around the country, but there really isn't much in the way of scientific evidence that any of them are useful.
Okay. Do you believe PANDAS is hereditary?
First of all, I'm not sure PANDAS exists.
Okay.
Second of all, if PANDAS exists, I think there very well might be a hereditary basis. That is, in our study at least, the children with PANDAS were more likely to report a family history of rheumatic fever. So I think that does suggest the possibility that they might have a genetic susceptibility to get strep. And also our PANDAS cases were more likely to get strep than the controls. So I do think that there might be a susceptibility. But again, keep in mind that if a child has more strep infections, you're more likely just by chance to see a link between strep infection and a clinical exacerbation. So that link could be a total artifact in children with PANDAS just because they get more strep infections.
Okay. If you put your child on a regimen of antibiotic, is there any one that's better than another?
A regimen of antibiotics for PANDAS?
I would say yes, that's what they mean.
At this point, I can't recommend the use of antibiotics.
Okay. Fair enough. In the studies you've mentioned ADHD predominantly. Have there ever been any studies regarding ADD specifically?
Well, nowadays, everything is called ADHD. And the distinction between ADD and ADHD is old and no longer used. So everything is really subsumed under ADHD. So when I say ADHD, that includes children with or without hyperactivity.
Okay.
But there's been very, very little bit in terms of good scientific study of any relationship between strep and ADHD. I think there are very few people who believe that that is a likely link.
All right. Do you have any comments on natural remedies for treating infections, echinacea, golden seal, any of those things?
As I said, I don't.
Okay. Let me see. I'm trying to find that question, Kelly. Do individuals grow out of TS?
Yes, the prognosis for TS is actually quite good. The statistics suggest that about 2 out of 3 children will outgrow their Tourette syndrome or have a significant lessening of their symptoms when they grow into adulthood. Only about 1 out of 3 cases seem to carry their tics into adulthood with a fairly significant severity. So the majority of children actually do outgrow their Tourette's.
Okay. Do you know of any research being carried out with I'm probably pronouncing this wrong, rheumatology and immunology looking at family history?
Yes.
Of autoimmune diseases.
Yes, this whole notion of PANDAS has spurred a lot of those kinds of studies. So the one I mentioned about D817 is the first example. D817 is a marker that's on our white blood cells, and people who have D817 positive seem to have an increased risk for developing rheumatic fever. And so that is considered to be a genetic trait. So that is really the first study that has looked at the relationship between immune factors and genetics related to this issue of PANDAS. But as I've said, there are just as many studies that show no relationship with D817 as that show there is a relationship. So it's very up in the air. It's definitely something that has not been settled.
Okay, somewhere along the line, I didn't exactly hear your comment, but there was a comment that you made about the onset of Tourette, and nothing about this discussion of PANDAS changes the typical standard of the onset between 7 to 8 and as old as 18. Is that correct?
Are you talking in relationship to PANDAS or just in general?
Well, I can't find the question specifically here, but I would say specifically to PANDAS.
Okay, if you go by the criteria that Sweeto outlined, the onset of PANDAS must occur between the age of 3 and the development of puberty. So by Sweeto's criteria, the onset is what's called pre-pubertal, as before the development of puberty.
Okay.
They do not think that PANDAS can start after puberty. But that's also really the same ages in which Tourette syndrome itself can start.
Okay. What are you doing to further study PANDAS moving forward?
Well, what I'd really like to do is to try to study this new cohort of patients that have these very acute, very severe onset of symptoms and that have these changes of the brain on the MRI. I think that in the future, if PANDAS is real, that's where it's going to lie. It's pretty clear now that if you look at a child that really looks like a fairly typical Tourette's or OCD case, that strep really doesn't seem to have much to do with it. There's now 2 very large, very well-done studies, one of which I just described to you. And there's a lot of information from epidemiology looking at large patient databases. One was done in the United Kingdom, and there's very little evidence that a child who develops a strep infection is more likely to get OCD or Tourette syndrome. So I think the money in PANDAS, if PANDAS is a real bear, is going to be with these different cases, these very acute, severe cases. And I think there might be something to that. I think there may be a true strep-related autoimmune process. My impression is that they're very rare. There probably are handfuls of subjects around the country. And that, I think, is really the next step. So a number of researchers in this field have been talking about trying to identify these cases and bring them together from around the country.
So how would somebody find out about that?
Well, it's not going yet, but
okay.
Once it is, we probably will be publicizing through a variety of websites, including your own and possibly the Tourette Syndrome Association or the OCD Foundation.
Okay, good. I just want to say that we have a few more questions to go, but we are approaching the 60-minute mark in this presentation. So if any listeners need to exit the webinar before it's completely over, I just want to remind you that when you do exit, a survey screen will open, and I hope you'll take a moment or two to complete the questions. Going back to a question, you said that stress releases dopamine and it seems to trigger tics. Is that correct?
That's correct.
Okay. If so, is there any medication that would decrease the release of the dopamine? In this particular situation, Topamax has helped my daughter, but does it have anything to do with decreasing dopamine?
Well, decreasing or blocking dopamine is the standard in treating tics. So the most common and the most predictably helpful medicines for treating tics block the receptors for dopamine in the brain, or they decrease the release of dopamine in the brain. And so those are the typical medicines that we use to treat Tourette syndrome and tics. So there's very strong evidence that there is an excessive effect of dopamine in the brain associated with tics. So yes, there are a whole variety of different medications that reduce the effect of dopamine in the brain, both the release and its interaction with its receptor in the brain.
Okay, is Topamax one of them that does that?
Topamax does not have a major effect on dopamine, but it does affect other chemical systems that interact with dopamine. So there could be an indirect effect on dopamine.
Okay, great. Is the release of dopamine also associated with sudden onset OCD or just with tics? Or is that all part of the whole stress connection?
The release of dopamine has not been studied as carefully in OCD as it has in Tourette syndrome. But it is interesting that OCD can also improve with medications that block the effect of dopamine. So dopamine probably is quite important in the development of OCD.
Okay. At what age do PANDAS symptoms start to dissipate?
Again, I don't really know if PANDAS is a real entity. The literature really doesn't exist for the most part. The cases that have been described are largely talking about the onset or the first few years of the illness, and there really hasn't been much in the way of reports of what happens to these children once they grow into adulthood or in later years. So that's an open area, I think.
Let's see, I have an MRI question here. Do you recommend MRI to study the brain for TS diagnosis?
I generally don't recommend an MRI. For the most part, we think Tourette syndrome is largely a chemical disturbance, and that's generally not something that would be visible under an MRI. There are a number of studies that suggest that if you look at large groups of patients with Tourette syndrome and you compare them to a group of patients who do not have Tourette syndrome, that the Tourette syndrome patients do, as a group, have some differences in terms of the sizes of different parts of the brain. But it's not useful and it's not helpful for an individual patient.
Okay. All right, I think we're down to our last question, and I'm going to ask that now. And are we any closer to understanding the cause of TS than we were 10 years ago?
I think from 10 years ago, we're not a heck of a lot closer. I think 10 years ago, there was actually a lot of excitement about the possibility that genetic studies would, in fact, give us the answer. But I think the last 10 years has been pretty disappointing in that we still don't know which genes in the brain are involved. And if we don't know which genes are involved, we don't know a lot about the basic molecular mechanisms in the brain. So there also has not been a great advance in terms of available treatments for Tourette syndrome. Perhaps the most dramatic advance has been the possibility that deep brain stimulation might be useful for patients with very severe Tourette syndrome. But unfortunately, I think the past decade has not been too kind to Tourette syndrome, and we're not too far ahead in really understanding things. So I think there really needs to be a large push in research to understand things better.
And deep brain stimulation would certainly be kind of a, I don't want to say last resort, but pretty close to that, correct?
Yes, it's generally considered to be pretty much a last resort in people with very severe tics that are unsatisfactorily controlled by available medications or behavioral treatments.
All right, I have one more question I want to ask. Is there a connection between adrenaline release and dopamine? Do they kind of work the same in the brain?
Adrenaline and dopamine are in the same family of neurochemicals. And in fact, you can convert dopamine to adrenaline, which is another name for adrenaline is epinephrine. And there's an intermediate step called norepinephrine. So yes, these are all what are called catecholamines. And just like I said that we now know that dopamine is released both in the brain and into the bloodstream during periods of stress, we do know that its cousin epinephrine and its other cousin norepinephrine are also released. So they're very closely related.
Okay. All right, Doctor, thank you very much. That concludes the Q&A portion. I do want to tell people that if we did not get to your question, then Dr. Kurlan will be answering it as part of the chat board. So I'm going to sign off and turn the next part of the evening over to Kelly.
Thank you, everybody.
Thank you for joining our webinar on Can Strep Infection Cause TS? Is PANDAS Real? There is an exit survey which should show on your screen as you exit. Please fill out the evaluation on the exit survey. The discussion board will be open tomorrow and available for the next 7 days on the NJCTS website for any additional questions that were not covered in tonight's presentation. The website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted to the site. Our next presentation, Family Dynamics in Parenting with a Child with TS and co-occurring disorders, is going to be presented by Rob Zambrano next Wednesday, March 3rd, 2010. This ends tonight's webinar, and thank you, Dr. Kurlan, for your presentation, and thank you, everyone, for attending.